Carlson, Directing Attorney, Justice and Aging, a wonderful partner to St. Barnabas. Eric.
Thanks, Rigo, and thanks to all of you for the opportunity to be here. I want to just describe a little bit about what's going on. We at Justice and Aging do a lot of work on healthcare, not surprisingly, focusing on what it means for people across the country who don't have much money. And this repeal legislation is out there right now. This repeal and replace legislation would really be catastrophic for older Americans. Let me start by what this would do to the Medi-Cal program in this state. Medi-Cal is really important for, this is not news, I'm sure, to a lot of folks in the room. Medi-Cal is incredibly important to older folks across the country, including California. Covers people who otherwise don't have quite enough money to pay for their health care. For folks who have Medicare, it fills in some of the spaces that Medicare doesn't. There's lots of holes in Medicare, and Medi-Cal helps cover those holes for people who otherwise couldn't pay the premiums or couldn't pay the deductibles or the various charges that are assessed. And particularly important, Medi-Cal covers a lot of the necessary assistance for people who need help with basic daily things, dressing, eating, getting around, shopping. People who are unable to handle all those things, who need some help to handle them on a daily basis. Medicare doesn't cover that stuff, right? Medicare doesn't, it doesn't. And what you need in that case is Medi-Cal, which in Medi-Cal covers things like in-home care that people need, in-home care, daycare, that's what Medi-Cal covers, and Medi-Cal covers nursing facility care, nursing home care. That's what Medi-Cal covers. And up till now, Medi-Cal, the Medicaid program started from the mid-60s. And up till now, it's been set up like most insurance programs. It covers care that's medically necessary. If you need something, and the doctor says, yes, this man, this woman needs this particular kind of care, and it's covered under Medi-Cal, Medi-Cal will pay for it. But this bill that's out there right now in Congress would flip that. The bill is set up to cap the overall funding at a certain level and just freeze it, or just allow tiny little increases, inadequate increases from that point forward to starve the Medicaid program going forward. And that's how it's set up. I'm not going to toss out a lot of numbers here. There's a lot of them floating around, but the congressional budget people say that at the end of their period of estimation, the amount of money that would be available for Medicaid would be cut by 25%, right? 25%. So if anybody who's running on a budget knows, if all of a sudden you take 25% of what you've got and get rid of it, you got a real problem. There's not enough there. There won't be enough there under this budget. So what will happen if this bill will become law? What are we looking at here? The state of California, at this point, is going to get substantially less from the federal government, down to 25% less money. What's the state of California going to do at that point? They're going to cut things off. A lot of Medi-Cal programs are optional. A lot of home care programs are optional. The state may likely eliminate that. The day services programs, by and large, are optional. The state could eliminate that. And in other programs that may continue to be required, the state's going to cut back the eligibility requirements, right? To change the standards, the financial standards, or the kind of healthcare need that's required to lop off people and lop off people and lop off people. It's inevitable, really, the way that this is set up. And so what does that mean on a practical level, on a personal level? For me, for you, for our parents, for our grandparents, what does that mean? It means more falls, more broken bones, less assistance, less health care, more uncontrolled diabetes, all of those things that we're trying to manage, we're trying to prevent. They're going to happen more frequently if this were to become law. So what does that mean for us? We shouldn't let it become law. Right? We need to do everything we can
That's right.
to keep this from happening, and that's the reason for this event here and other things. Medi-Cal's been incredibly important for all of us for these 50+ years in county. And I would encourage everybody in this room to do whatever they can to make sure that this bill never becomes law.
No, you're right, brother.
Thank you very much.
Thank you.